switch your view to gallery, please?
Thank you very much indeed. I sincerely apologise for technical difficulties today.
Robert, we've just suspended because you had problems. So if you start again, I'll give you another count, 5 seconds.
Okay.
Okay, here we go, 5 seconds. 5, 4. Okay, go for it, Robert.
Order. Good morning, everybody. Thank you to our witnesses and my colleagues for being so incredibly patient and kind. A few technical difficulties today, but thank you for coming. For the benefit of those watching on Parliament TV and the transcribers, could I just ask the two witnesses to introduce themselves briefly and state what their organisations do?
My name's Javed Khan. I'm Chief Executive of Barnardo's, which is the UK's largest children's charity.
Thank you.
And I'm Jenny Coles, President of the Association of Directors of Children's Services.
Thank you. If I could just ask you to give a state of play in terms of what you think are happening to vulnerable children in the lockdown. We know that very close to 90% of vulnerable children are not getting any kind of education, according to the government statistics. What's the impact on those children, and who do you see as being the most disadvantaged and vulnerable?
So if I may start, we are at Barnardo's seeing an enormous impact on vulnerable children. I mean, they're the only children that Barnardo stands to support. And we would argue further and say that there is a risk of potentially losing a whole generation because of the impact of what is going on at the moment. And I'm talking about specifically the vulnerable. And of course, in times like this, it is the vulnerable who suffer most. So we're seeing that exhibited in a whole range of ways. We're worried about what's going on now, which is the increase in poverty for a whole range of reasons, the increase in mental health challenges that the vulnerable are suffering and not getting support for. We're also worrying about the medium and long-term impact of when we come out the other side of this. We're going to see these challenges exacerbated in a whole range of ways, and we're worried that the systems that are in place will not have the resources or with the wherewithal to respond effectively. We're also really worried about the inequality of what is going on. The virus, I would argue, does discriminate in a whole range of ways. Far from being a great leveler, I think it's hitting the most vulnerable the hardest. There's twice as high death rate in deprived areas, and all the research is showing that. BAME people are more likely to become seriously ill and less likely to survive it. The impact of the lockdown is having a greater effect on the poor and the most vulnerable families. And many families that we work with, and there are many others that we haven't been able to reach, I would argue are experiencing poverty, experiencing abuse, experiencing mental health for the first time in their lives. And yet, to be able to provide the support for them is extremely difficult.
Jenny, do you want to comment before I come back?
Yes, I would certainly agree. In terms of households and families that were already facing challenges, these have been amplified during this current crisis, particularly if you're living in overcrowded conditions, you have challenges around your finances, and of course the real worry about whether or not you'll have employment as we move through this. I think the long-term impact on children will only become seen over a period of time in terms of their educational outcomes and their emotional and mental health. However, what I've also got to say is that we have had anecdotally information, particularly around looked after children, where they have begun to thrive in an environment where they don't have the pressures of going to school all the time. And I'm not saying that that's something that should happen even in the short or medium term, but there has been, particularly children that are in foster care, that we have reports that they are thriving and that they have been able to cope. But as I say, the long-term impact on children, I think, will only come out as we begin to see restrictions lift, and we can therefore reach more children.
And have you done any, both of you, any specific surveys on vulnerable children? How many there are, what's happening to them, whether or not they're being educated?
Shall I start on that first? We're just about to do, I know locally, local authorities are now beginning to do those surveys. We have about, at the end of April, there was about 14% of vulnerable children attending school nationally, but in many local areas, that's 25 or even increasing. We're seeing an increasing number of children going back into school. And I think as restrictions lift, it's been a real challenge for families who have been, in terms of their parenting, have got challenges. And so they've accepted the message of stay at home and stay safe. But as we see restrictions lift, we're definitely seeing more children go back into school.
So we recently did a survey of our frontline practitioners, about 1,000 of them, and we asked them, how is it looking on the ground? And so 76% of them are supporting families affected by school closures at the moment in a whole range of ways. 38% are supporting families where children can still attend school, but are choosing not to. 48% are reporting young people or families that they have safeguarding concerns about and are refusing contact due to self-isolation. So the challenges are broad and different in different settings. We know that the Department for Education was hoping that school rolls, about 20% of young people would continue to attend school. So these would be the vulnerable, those who've got social workers, those who've got education healthcare plans, and the children of key workers. And that has turned out to be actually only about 2% of children are still attending, and only 5% of those who are designated as vulnerable. So there's a whole swathe of young people we know that are out there that are either choosing not to go to school, their parents are not sending them to school, or at worst, they are going missing on the way from home to school.
And given this, and other organisations have said things similar, what is the way we can help these children both now and in the aftermath?
I think their return to school, but in a phased way, in a supported way. School leaders and schools know their children and they know their families, and they have been keeping contact with them. So it needs to be done in a measured and very planned way, and that's going to be taken over a period of time. So that's the first thing. I think services, certainly local authorities, rapidly changed what they were doing when restrictions were put in place. And so they have a whole variety of ways that they're making contact with families very regularly, those that they know, for example, using WhatsApp, virtual ways, examples of children showing social workers around their homes, as well as face-to-face contacts using social distancing in gardens and so forth. So there is a whole variety of ways that services are carrying on. What concerns ADCS the most, though, is the preventative services that are in place so families can easily access them when they're having challenges. And these have been restricted, particularly, as I know Javed was saying, in terms of charities. So we're really worried about the sustainability of those.
And the suggestions that have been mooted in public, I've done some of this, but there's a lot of organisations like the EPI, the Children's Commissioner, and others have suggested a catch-up premium. They may have a different term for it, and perhaps extra mentoring, pastoral care, and tuition done by retired teachers or graduates or Ofsted inspectors. What do you think of those thoughts in terms of helping vulnerable pupils?
Well, certainly those pupils that are disadvantaged and disaffected before all this happened, this period out of school won't have helped them, and they will need extra help and extra focus as our priority pupils as we have a gradual phased return to school. So those extra resources that schools have, I think, need to be led by schools and what they know their pupils and what they need. And indeed, there's a variety of support services from across all agencies, the local authority in terms of support services, but also mental health services, which will be needed as we move forward, and we can assess what trauma and anxiety pupils will have when they return to school.
Thank you. And Javed?
I think there's some fantastic practice going out there, as Jenny says, where schools are working really hard to stay in touch with the identified vulnerable, those who are on the social care registers already, trying to stay in touch with them one way or another, whether they're attending school or not. Local authorities are working with head teachers. I saw a fantastic practice of that in Birmingham the other day, where head teachers are working with the local authority and with the voluntary sector, trying to prepare for that return to work, return to school kind of phase. The challenge, though, I'd ask you to think about is not only those who are on the registers of being recognized as vulnerable. I would argue that there are millions of other children out there who pre-COVID were not known to the system, as it were. So they're not the recognized vulnerable that the government is regularly talking about. These are the hidden children who, as a result of COVID, have now been driven into poverty. There is the impact of the isolation that they are living with, mental health issues that they are now facing that they weren't before, who are on the edge of becoming one of those statistics. They are not being contacted at the moment because they were not on the systems, the registers, before this all began. How many of them are there out there? We don't know, but they are the people that Barnardo's and others like us are trying very hard to reach and give a lifeline to. Now, the worry is that when we come out of lockdown, when schools open again, gradually and then fully, I believe there's going to be a huge spike in the demand from those young people who are currently not being recognized.
In a nutshell, my final question before I pass over to my colleagues, what's the answer? What would you suggest, Javed?
So your first question was about an increase in funding. I think schools are desperately going to need an increase in funding, whether it's through the pupil premium or the catch-up or whatever you call it. But let's be careful about what that money is going to be used for, because catch-up gives the suggestion that this will be targeting about, helping young people catch up with their education, and there's an academic flavor to that. That is going to be needed, but there'll be many other young people who will need a different kind of support, whether it's intensive pastoral therapeutic support, intervening as quick as possible to provide them a whole wraparound services to stop them from going into care, stop them from becoming one of the CAM statistics. And the answer to that is that schools alone will not be able to do it. Local authorities alone will not be able to do it. We really need an interdependent strategy that brings in the charity sector as well, because we provide the glue often that holds communities together at really difficult times. We are trusted by many of the families.
Thank you. I'm going to bring in, before I bring in Jonathan, I'm going to bring David and Tom, David Simmons and Tom, who I think who have questions. David first.
Thank you, Chairman, and good morning, both witnesses. Two connected questions to both of you. One, what more do you think schools could be doing in the current climate to support vulnerable children, particularly given that schools are largely empty, so you have fully staffed schools. Therefore, they have more capacity potentially to be supporting, in particular, the work of local authority outreach teams. And then perhaps this one more aimed at Jenny. What additional powers, in your view, would local authorities need to respond even more effectively to some aspects of this? And I'm thinking in particular of the ability to track down some of those vulnerable children, to make sure they're getting access to what they need, and to make sure that schools are held to account for providing that.
So if I may just pick up firstly on schools and what more they could be doing right now on top of the challenge that they're already facing. I think as the lockdown eases gradually, and these hidden young people that I'm talking about, that we are in touch with and trying to provide support with digitally, using video conference and telephone and so on, the schools are a great resource. They are often the largest safe spaces within a community that are being underutilized at the moment. So we could, for example, Barnardo's and others like us could work with the local schools and use the school building to begin to provide those face-to-face services using social distancing, because the spaces are large. So the therapeutic support, the kind of early interventions that I'm talking about. I mean, imagine young people, for example, who are not on the registers that I was talking about, yet they've suffered a bereavement during COVID. So they need specific support to help them get through that. That isn't going to be about academic support. It's going to be a whole range of counseling and therapy that's going to help them get through this. And we could be doing that literally now using the school buildings.
David, is that okay? Tom.
Firstly, thank you for everything you're doing, Javed. And it's also thank you also for those statistics, the data. There's not a huge amount of data around at the moment, particularly regarding to attendance. I was very concerned to hear that 48% where there's safeguarding issues. I think I was right in understanding that the parents are refusing any kind of contact with social services. I mean, that is deeply concerning. Of course, let's be honest, the reason why some of those children are deemed as being vulnerable because of these safeguarding issues is frankly because of their parents and concerns about them. Isn't it therefore strange that we put the ball completely in their court when it comes to their children's attendance at school? And perhaps do you think it would have been better if the government had made it more of a requirement that they attend school than just putting it entirely in their court? And then secondly, connected to that, it's interesting to hear, the attendance of vulnerable children was 14% in April, and some places gone up to 25%. Thank you for that information, Jenny. I was wondering if, obviously, vulnerable is a very broad category, but within that category, have you got any idea what the percentage of attendance is for those children where there are safeguarding issues? It'd be interesting to have that particular element.
Jenny, while you do that, could you also answer David's question? I forgot to bring you in before. Thank you.
I will do. I'll answer this first. So in terms of particularly, I can give you my local example in Hertfordshire. More children on child protection plans are attending school than any other vulnerable group. Yeah. We're roughly, that was so about 10 days ago, we were at 25%, and we're rising every day and every week in that category. In terms of, I think it's been a very difficult message to give because it needed to be really clear that restrictions were in place, stay home, stay safe. And parents have taken that on board. And I think more broadly, not just for parents of vulnerable children, but getting that parental confidence in terms of a phased return to school will lead a lot of work by central government and also local communities and local government. This is not going to be something which, is going to be fixed by June the 1st. It's going to take a lot of weeks and a lot of work to do that. So I think that's a really strong message which our association has been giving. In terms of local authority powers, we've got the flexibilities under the Adoption and Children Act. The association thinks that they're more than enough, that we would only use them in emergency situations. And all local authorities at the moment, surprisingly, our workforce in terms of children's services workforce hasn't been affected as much as we've thought it might do. However, as we move forward, I think our biggest challenges are going to come in the next phase. And we've heard about, as Javed have said, about referrals to children's services have dropped. They are beginning to rise again now, but in many places they dropped over 50% within 2 weeks. But they are definitely rising again. And the second thing I would say is that supporting vulnerable children and families is a multi-agency thing. Yeah. So it has been impacted, particularly by our health colleagues who have obviously been moved onto other duties, but they will begin to come back to their former roles. Schools operating, they're doing a lot of online work, but not seeing as many pupils in their key safe places. But our police colleagues have managed to keep their workforce, and so they have been, very much out in the communities and looking for safeguarding issues. So I hope that answered your question, David.
Thank you. I'm going to bring in Jonathan now.
Thank you, Chair, and thank you to the witnesses for attending today. As of August 2019, we know that half of all local authorities' children's services were deemed by Ofsted to be either inadequate or requiring improvement. At present, how well equipped are local authorities to review and assess the circumstances of every family and child they're currently working with? And to talk about the financial impacts, we know that in 2016 to 17, there was an overspend in local authorities by £714 million. What can the government do to rectify and give support to children's social care in order to make sure we get the best practice?
Shall I take that first? Children's services, local authority budgets were under pressure before this crisis. That certainly hasn't changed. And in terms of we were really pleased to get the funding to assist with the crisis, but already local authorities are seeing that this is not going to meet all the costs of what they need. So what ADCS is continually saying, what we want is a 3-year funding settlement. certainly across children's services and across special educational needs and disability. And then we can plan for our future. And in terms of the current crisis, we would say that the impact on children and the pressures that have been building that we've talked about will take at least 18 months to 2 years to work through potentially.
And what I would add to that is that I think local authorities are in a really difficult position at the moment and have been for the last 10, 12 years. So this isn't something new. The money that was available to them, and I used to run services as a director in local government as well, and that money has been wrenched out through the age of austerity, and that is bound to have an effect, and a dramatic effect. COVID is going to make that far more difficult than it has ever been before. That is our greatest fear. I think the worst is yet to come. And if we see a enormous recession, which is what we're expecting, all this trillions of pounds that's being spent at the moment is going to have to be paid back over a long period of time. And the history of our country shows, and the politics shows, that local government, the local functions that people rely on, will be squeezed. And so I see a perfect storm coming out of this the other way, when local government won't have the money to provide the essential resources and services that the most vulnerable will be relying upon. Often in those circumstances, they turn to the charity sector that plug the gap. The charity sector is reliant on donors' income because we fundraise. Donors will feel very insecure about their own sustenance, their own jobs and prospects and so on. And therefore, donating to charity is not going to be their priority. Survival is going to be the number one priority. And then the perfect storm just begins to revolve, and the most vulnerable will suffer the most. Now, I think one of the ways out of this is that local authorities have an enormous leadership role in their local patch. What we've got to move away from is a very traditional style of commissioning of services, where a few people in local government, and I used to be one of them, as I say, hands up, say that they identify the problem on their own. Then an even smaller group lock themselves in a room and try and work out what the answer is. And then what they do is bang out a whole load of tenders for people like us and others like us to compete with each other to try and see who can deliver. That whole model, I believe, is flawed and it cannot work in the future with greater limited resources and a huge spike in services. What we need is genuine strategic partnerships, interdependent working between the state at a local level, a range of providers, including the voluntary sector, right at the start of identifying what the problems are and therefore what the solutions could be. A kind of co-production, if you like, of the problem and the solutions, and pooling our resources, because we will all have resources from a whole range of sources that ultimately will have impact.
Thank you. Jonathan, do you want to come back at all?
Yeah, just very quickly, because in a place where where I represent in Stoke-on-Trent, we have a huge issue with a lack of foster carers. And I was just wondering, with that, you said that children in foster care are doing much better. But I was just wondering, are we going to see an issue in getting more people to step up and help out in that sector? Because that's a big fear of mine. I was also wanting to ask as well, we've talked about how we're helping the kids who are at the highest risk, but does that mean the kids who are low risk within social children's services are therefore being neglected or being forgotten, because obviously there has to be a priority? And then the final one, sorry, Chair, is that the Coronavirus Act 2020 has allowed the temporary lifting of the statutory duties on local authorities to maintain the provision in education, health and care plans. Was this something that social workers in children's services were calling for themselves, and what impact are these changes having in practice?
Okay, shall I start? In terms of foster carers, it's a really important issue to raise, and I think it'll only be, again, as restrictions lift, that we'll know about some inquiries. However, what we have heard is that people are still coming forward to go through the fostering process, which I think is really encouraging. However, there's a national shortage of foster carers, and we've also got foster carers, in terms of the demography of foster carers who will be leaving in the next few years. So it's an absolute priority, and it would be really good to see a national campaign about recruiting foster carers and raising the awareness of what a positive experience it is for foster carers as well as children. So that would be the first thing, and ADCS would really support that. So I think you're very right to be worried about that. The second thing around the focus on the high priority, given the situation we're in, local authorities have looked at prioritising their the families they're working with. But everybody, they're still following their statutory duties. All families are being contacted, as far as we're aware, using a variety of means. So when I was talking about using a variety of means for contacting and working with families, I wasn't just talking about those children that are on child protection plans. There's a whole range of work local authorities do, and indeed early help work with partners. Seen a lot of partner work in terms of, reaching out to families, particularly around those families who've got financial challenges. There's many good examples across the country, and it has been a big part of our work, and I'm sure will continue because of those financial challenges for families that we were talking about. I would just like to mention, though, going back to what Javed was saying, there is a lot of partnership commissioning, and just because we've had this crisis doesn't mean to stop. That is the way forward. And I think what we've found is local authorities have been real leaders of place and have looked at different ways of working in this short space of time. And we would really hope that would continue.
And if I can
Javed, just briefly, did you want to add, Javed?
Yeah, if, just building on what Jenny just said, I mean, I think there is an enormous risk of those at lowest risk, as you referred to them, of being forgotten. The hidden children, again, I keep making this point about those who are not on the radar at the moment. I mean, even if you take something as relatively simple as free school meals, which was welcome, a really good initiative. I know it's had some teething problems and so on, but it's running. It is only available to those who are on the free school meals register pre-COVID. It doesn't recognize those that have now been forced into poverty during this period. They are not eligible. They are part of those that are forgotten.
Javed, if I could just quote the Educational Policy Institute, they published, you've probably seen it, the report last week. They say also just what you've said, the consequences of the pandemic not only mean that we're at risk of not meeting the needs of children who are already vulnerable, but also creating many more vulnerable children, putting yet further strain on children's services. Although the government has announced an additional 12 million for vulnerable children, this relatively small intervention targeted on only a few areas of the country will not have a systematic or sustained impact on outcomes. Do you both agree with that or not?
Yes.
And just Jenny, in a nutshell, can you say why? Oh, and Javed as well, but in a nutshell.
Because these pressures were there for families before this crisis happened. And now so many more families are falling below the level of poverty because of the insecurity of their income.
Javed, briefly.
I would have said exactly what Jenny's just said.
Okay, thank you. That was brief. Thank you. Ian, can I just come over to you now, please?
Yes. Good morning, everyone. And I would just like to ask the two members of the panel, do you agree with Anne Longfield, the Children's Commissioner, that the government's recent changes to adoption and coronavirus regulations are unnecessary and lack any real consultation?
So shall I start first?
Please, yeah.
I think that the flexibilities to the Adoption Children Act came out before the guidance. The guidance came after it and put it in context. So that's the first thing I'd say. The second thing is, it was done at a time when lockdown just happened. People didn't know what was going to happen, particularly around the workforce in children's services. And in an emergency, those sorts of flexibilities may well be required to keep our services running. We've got to keep running. We've got to keep children in care being looked after, and we need to respond to families. But I really want to emphasise that those flexibilities will only be used in an emergency and not frequently, and they will be frequently reviewed. And I do think that it's necessary to have those in the background, but they need to be very carefully monitored, which they will be by the local authorities and I'm sure by the DfE as well.
Can I ask, Jenny, was the ADCS fully consulted on the government's coronavirus adoption regulations?
In the early stages, we were involved, but we weren't consulted on the final stages and when it was published.
And are the changes in practice being used as a last resort, or are they likely to be relied on more widely? And how long should easements last?
They're only being used in an emergency. We've heard that from a whole variety of local authorities. Local authorities are determined to fulfill their statutory responsibilities in a variety of ways, and they need to be continually reviewed.
Javed, have you?
I was pleased that the Children's Commissioner raised this issue, and it was an example of a rare focus and intervention on vulnerable children and young people. We just haven't been hearing enough about this through the whole of the crisis. Having said that, though, no agency can continue to operate during this crisis in the way that it was before. So I understand some of the logic for the relaxation of some of the regulations. I've been asking the Department for Education to make sure that they put in place specific monitoring for the impact of this flexibility on the most vulnerable, and to make that impact assessment available publicly. I'd go further. I think it needs some independent oversight as well, and a report perhaps from your committee at a future stage.
Thank you very much. When schools are thinking about preparing to bring youngsters back, of course, they won't just be dealing with youngsters who may have regressed from an educational perspective, but there'll be all sorts of other problems in terms of the different sorts of a lack of social contact that youngsters have had. So what should schools and children's services be doing to prepare for an increase in children and young people with mental health needs following the pandemic?
Okay, shall I start on that
Please,
one?
yeah.
I just really want to emphasise that the lead-in time for any phased return to school needs to be long enough. And we'd be saying 5 to 6 weeks to put exactly what you're saying into place. So a whole safety and practical issues, but also the support which is wrapped around schools. So for example, you know, mental health support, counselling support, behaviour support. Really important that that's put in right from the beginning, and then schools will be able to assess and draw on that support being available. There was an increasing amount, particularly around mental health support for young people, and those being in schools. But of course, you know, some of those resources have had to be taken away in terms of because of the COVID situation. So we need to assess whether or not they're in place. And I do think we've been talking about the whole range of pressures that young people and families have been facing, and we'll need to assess that. And it's very likely to be a shortfall as we move forward.
Javed?
So yeah, as a former maths teacher and a director of education once upon a time, I mean, I understand really well the pressures that schools face and will face when we come out the other side of this. So I completely agree with Jenny. I think the focus has got to be that alongside the academic support that young people would of course need, the pastoral care is going to be absolutely critical, and the schools alone will not be able to provide that. The teacher cannot be the teacher and the social worker and the therapist and the counsellor. So we're all going to have to group together. Now that is going to cost. So some resources are going to have to be specifically made available, I believe, at the local authority level and in the schools' hands. Now, great schools do this really well already and are preparing for it. And I gave an example earlier, but we've got to make it consistent across the piece.
And is there anything that you think that CAMS will have to do in terms of preparing for this, or are they geared up? Because, you know, CAMS is a patchwork quilt, and in some areas it's about passable, in other areas it's not very good at all. So is there anything specific that you think CAMS should be doing in order to prepare for this?
So if I may start on this, Jenny, I'm really worried about CAMS. I think CAMS was in crisis before we came in to COVID, you know, with some waiting times for first referrals around 9-10 months, and over a year in some cases for treatment to begin. Now those numbers have been coming down and great effort has been going on across the country, but still that just is completely unacceptable. I mean, imagine, put yourself in the shoes of that 13-year-old young girl who's got social anxiety, has been referred and has to wait 8, 9, 10 months before she gets any support, and what damage that will do to her and how worse the situation will get. So my suggestion would be, and this is based on practice, that Barnardo's is running services up and down the country. If you go to Solihull, for example, and visit the Solar service, Barnardo's is running the equivalent of what was called CAMS before, in partnership with the local NHS. And what we've done there is taken away the traditional 4 tiers of CAMS. So tier 1, 2, 3, 4, gradually getting worse, you know, with residential care right at the top end, and investing the bulk of the resource at the earlier stages. So early intervention at the first signs of challenge, intervening really early, rapid support, rapid referral, multi-agency, and that has reduced considerably the number of young people who then have to go into tier 3, tier 4 services. It's a dramatic improvement. Now, that is possible because the tiers are not a statutory obligation. It's just custom and practice that those have been put in place. There are alternative ways of doing this, and that's what I would encourage CAM services up and down the country to think about.
Okay. Before I pass to Tom, I've got a question from Caroline, Dr. Caroline Johnson, who has tech difficulties from where she lives. Previously, Jenny said that 25% of vulnerable children in Hertfordshire are attending school, although 100% are eligible. I gave a figure of close to 90% across the country. She's asking, is that 25% typical of the UK as a whole? And what are they, what should be done to increase it? And why is this so low, the attendance in school of vulnerable or any vulnerable children getting any kind of education at all?
I think I'd return to the message, the strong message, the rightful message in terms of stay at home and stay safe. But we're now moving to a different phase. And so a strong national message around vulnerable children attending school would really help social workers in terms of encouraging them. And because we are seeing an increase every week, and we've had an announcement about schools phased returning, all of those things will help those local workers on the ground to give confidence to those parents to get their children into school, because, they have a rightful place. So there's a national message as well as a local message, which will be really, really important, that, it's good for your outcomes and it's safe to do so.
And Javed, do you have anything to add to that?
Yeah, I think, it's time now for a national campaign driven by government in the way that there was a campaign around stay home, stay safe. Now I think the public have to hear the message. If we want young people to go to school and we want the teachers to want them at school as well, because we know there's a big backlash from teachers who are saying, look, the environment isn't safe for us. There's got to be a considered campaign to try and address the issue that Jenny's talking about of the confused messaging that has been in place to date. And you can't blame parents. I wouldn't blame any parent for not sending their child to school at the moment because of this confusion of, well, they don't want to put their child into a high risk environment. So they'd rather keep them at home. Now, to address that, a considered campaign has got to be launched across the country to try and change people's views on it.
Yeah, we also know that according to the Sutton Trust, nearly 2/3 of children are not accessing any online education as well. And so that is also a separate problem in itself. Can I please come on to Tom?
Thank you. So it's linked to what I was asking earlier. So some pupils will be vulnerable to crime and abuse. Are child protection conferences and multi-agency front door assessments still taking place as before, or have they been reduced?
So
that's to Jenny.
Yeah. Okay. Right. Yes, certainly. All front door referrals to children's services, they're opening. They're all operating as they were, and we've seen the evidence of increased referrals starting generally across the country now, week by week. In terms of child protection conferences, yes, they are still operating. They're using a software platform. And also the families still have the opportunity, if they haven't got technology, to come into local authority offices using social distances, not only for that, but also, for example, they might be meeting a legal representative as well.
Thank you. So a second question, where teachers or charities are concerned about a pupil who may be deemed to be vulnerable, but without a social worker, how easy is it to get them referred and supported? I mean, talking locally, I know that in Suffolk, there's, I think since the outbreak of, since we implemented some lockdown, there's been a 3% drop in the number of referrals. So this is a serious concern, and I just want to know what your views on that question.
Yeah, absolutely. And so I know local authorities, indeed my own, have been doing weekly social media campaigns, getting information out to the community about this is what, keep your eyes alert. If you've got concerns, then please ring, this number. And in addition to that, the police have been doing a lot of media things, particularly around, I'd like to say, around domestic abuse, and getting that on the community's radar as well, and showing helplines and so forth. So safeguarding partnerships on a multi-agency basis have been putting regular communication out there. And of course, there's the NSPCC of doing their month-long campaign at the moment as well.
Thank you.
So if I may add to that, specifically to your question, how easy is it? It's not easy at all. It's really difficult. And I'd probably split it into two bands that we are seeing on the ground. That because most of our support services have now had to become digital, virtual, that is proving to be working with those vulnerable young people that we already had a relationship with. So the relationship is relatively strong, and the alternative way of staying in touch is generally working. It is proving far more difficult with those who are new referrals, because that relationship doesn't exist.
I'd agree.
Thank you very much. Yeah.
Thank you. Absana.
Thank you, Chair. I should probably begin by sort of saying that I was an employee at Barnardo's before being elected, so I thought I'd just declare that. My question is to both, well, actually to Jenny. How useful and supportive has it been to have Ofsted inspection teams and departmental officials deployed to those local authority teams most under pressure and in need of support?
Yes, I know colleagues across the country have taken up that offer, not just in children's services, but actually in education and early years as well, because there's been a full range. And that offer was made really early on, within the first week. So in terms of take up, not every local authority has needed that, but those that have found that useful across the whole spectrum of what children's services do.
And I don't know if, Javed, from your sort of interactions with local authorities, if there's any comment you have.
You must be old friends, you two.
Well, all the best people once upon a time worked for Barnardo's, I'm told. So yeah, I think this was a necessary action. I think in the current climate, it was exactly the right thing to do. But I hope that pause is not going to last for an extended period, because I think that check and balance that Ofsted provide is a valuable oversight.
Thank you. Absana, do you want to come in at all?
No, I think that's been.
Okay. Would any other colleagues who haven't had a question in this session like to come in? Dawn.
Thank you. Thank you both for your evidence today. You've quite clearly outlined that disadvantaged children are more disadvantaged by COVID. And you've spoken very clearly about the invisible children or the hidden children that are now vulnerable and disadvantaged. I'm just wondering, so the structural inequalities have been exacerbated by COVID. What needs to happen now before schools open to ensure we don't make the situation worse?
Shall I start? I think it will be really important as schools go back to really consider their local communities, because, as you say, some local communities have suffered more than others in terms of death and bereavement during COVID. And indeed, I know that the DFE are considering that as well in terms of the guidance that they'll continually put out. And that's very much in the minds of schools and communities in terms of their preparation. And hence, when I said, you know, ADCS are clear that we need that schools and local authorities need a 5 to 6 week lead-in to prepare for this, because it's really, really important.
I think, Dawn, one of the key commitments that we've all got to make is to be brave and bold enough to talk about the discriminatory impact of the virus. You know, I think there are still too many people out there that are choosing not to talk about this, choosing to ignore some of the statistics out there, and that is an enormous weakness. And you know, all agencies are responsible for addressing this and embracing it and recognizing that there is a disproportionate impact on BAME communities, and therefore on BAME children and young people who will suffer more. And it's not until we accept that we can start putting together the strategies which have got to include the communities themselves. Because all of the experience shows that, you know, when you really want to get close to the challenges that BAME communities are facing, you've got to work within the communities and not do to them, but work with them.
Dawn, anything else?
Thank you. And is there anything that, thank you very much. And is there anything that, so working with the communities, is there anything the government has announced that schools will reopen in this phased period? Do you think that it's feasible for schools to reopen without this 5 to 6 weeks lead in and without implementing working with the communities before you open the schools?
Schools are very connected to their communities, but there's a whole range of things which need to be put in place, and this is a really important part of it. And school leaders and school staff have got to feel confident in having children back and being able to deal with this. And as Javed said, it's really important to talk about that. And I know colleagues, ADCS colleagues in London, for example, it's very much on their minds, and it will take time. And it's about time and confidence and talking about it openly, as Javed was saying.
Thank you both very much. Thank you, Chair.
Just finally, I understand that obviously schools are not going to be open officially in the summer, and we're going to ask the next panel about this, but should there be summer schools, as in people like Barnardo's, other charities going to help with both the education and the pastoral care? And I'm very clear about the pastoral care and the well-being of pupils, that they could go in and have that help, that catch-up help in whatever way they need it. Is that worth something the government considering supporting?
Yes, I'd say it definitely is, because, you know, there's a whole range of summer schemes that operate during the summer for children, and I'm sure that they and their parents must be wondering what's going to happen. So in terms of doing the work to enable, you know, possible around social distancing and so forth, but, you know, they happen anyway over the summer, and over this summer they're probably needed more than ever.
I completely agree. I think it'd be a great move if that could be put in place. And another practical example is that even the free school meals vouchers, you know, I would hope that that can be extended to September and not end at the end of term.
Okay, we've got to, can I first thank you both for what you're doing in your work, and Barnardo's as well. I really appreciate you coming today. And if you could thank all your workers on behalf of the Education Committee, especially at this time. And thank you again for your patience with the technical difficulties that we started slightly later. I wish you both and your organisations very well. And we're going to have to suspend the panel while we have our second panel on. So thank you, both of you.
Thank you.
We'll be suspended for about one minute. Order, order. Good morning to both of you. Thank you for attending today. For the benefit of the tape and those watching on Parliament TV, can you introduce yourselves and your positions, please?
Yep, so my name's Paul Whiteman. I'm the General Secretary of the NAHT, representing school leaders across all sectors.
Thanks.
Yes. Hello, my name's Emily Konstantas, CEO of the Safeguarding Alliance. We're committed to raising the standards and safeguarding schools.
Thanks. I just should declare that Safeguarding Alliance is partially based in my constituency as well as London, and I know the individual Emily very well, so I just want to get that on record. Could I just ask you, start off with you, Paul, first, if I may. Is it your view that all schools should be providing some contact, whether it's online learning or paper homework or phone contact, if possible, with pupils?
So most schools, in fact, nearly all schools are. We've been surveying our members over the last couple of days, and we'll share some of the statistics that I'll talk about today with the committee, but they're only fresh into me this morning. But 99.7% of respondents to our survey are providing exactly the type of contact that you described. And the small fraction that doesn't hit that 100% are probably doing it through a hub or through a local partnership where their individual circumstances prevent them from doing it. So that is happening. No doubt we're getting to some of the difficulties preventing that happening as successfully as we'd all like, but it's not for a lack of effort.
So I absolutely hugely appreciate the work that schools do, and clearly the vast majority are doing that. But can I just look at the teacher TAP survey that has come out recently? They did a survey suggesting that 25% of teachers contacted no pupils last week. I appreciate that 75% are, but 25% is 25%. And then they looked at year 11 pupils, and 17% of teachers have stopped, have set no work. Sorry, 13% of teachers have set no work during school closures. And overall, it's something about, I would say, about 17% did initially and have stopped this term. Could I just ask you, do you recognise those figures? And if so, why is that happening?
So the figures that are there talk about individual teachers. The responses that we're getting talk about what overall schools are doing. So I can't account for the reasons for individual teachers. Perhaps they're not taking part as much as they might otherwise do so because of their own domestic circumstances. Only about 70% of the workforce is available to schools right now because of their own shielding requirements and things like that. So what I can tell you, though, from our respondents is that the vast majority of schools are contacting children at least weekly, some even more frequently than that. And they're doing that through a mix of teachers and leaders and contact points such as telephones, over online contact and email contact as well. So I think that the picture could suggest a lack of contact, but I don't think that's what's happening with overall school contact.
So another teacher TAP survey suggests that the contact between teachers and private school pupils is dramatically greater than those in state schools, and the more disadvantaged a pupil is, the less contact that they have with a teacher. Can you just give your view about that as well?
Yeah, so I mean, as well as the effort that goes into making the contact, it's the amount of reception to that contact that happens in the home. And we are experiencing some difficulty in making contact with some children and some families, and that increases with the more vulnerable groups and the groups that we would want to prioritise some more. So there's a variety of factors at play there. Obviously, there is some difficulty with online contact with those groups that have less access to the internet, for example, and we're experiencing that. So I think one of the points to make is the way schools have responded in a matter of weeks to changing the way they deliver education completely has been remarkable, actually. And although these statistics are as worrying to school leaders and teachers as they are to everybody else, actually it is an improving picture. And as time goes by, we're improving with every day.
So I completely recognise that. And just to be clear, I've seen in my own constituency the incredible work many teachers and schools are doing. I just wanted trying to understand those who are not having contact and the reasons why. And just to be clear, do you believe that every school should have some kind of contact with their pupils, whether it's via paper, via the internet, or via the telephone or video call, or whatever it may be, on a regular basis?
Well, all of those things are happening, and even extraordinary home visits are taking place as well, to establish contact where it might be difficult. So there's no lack of effort in making sure that that takes place. I think in terms of individual school circumstances, the schools themselves are still best placed to determine exactly how that takes place and identify their own issues and their own solutions. So that's what's happening right now. And as I say, it is an improving picture.
Thank you. Can I just move on to the announcement yesterday about school partially reopening, primary school, the years reception and year 6, and the secondary schools possibly? What is your view about that, and the view of the government's new guidance and things in terms of social distancing and PPE?
So the commentary here is very early. We're still getting underneath the guidance that came out last evening. Just excuse me for one moment. And we don't have a full understanding of the government's what the government will explain in terms of social distancing in schools and the demands that will be made there. So these are kind of provisional remarks right now. And I think what characterises our disappointment is contradictions in advice that's come out right from the start, even when we established the original list for vulnerable children and the original key workers list. They were difficult to interpret. We've got some difficulties with the advice coming through right now. And if I just take one piece for the example, there's a suggestion in there that schools, classes of 30 should be cut to classes of 15 for reasons of social distancing. If it's social distancing, we currently understand it. Our members are telling us that their building sizes on average would only accommodate classes of 10 to 12 rather than 15. So straight away, we're getting into some real practical difficulties about whether the government's ambition can be practically accommodated, let alone all of the fears that parents have about bringing their children back into school, and the fears of the workforce too about how their understanding of keeping themselves safe at the same time.
But do you believe that it's right that the schools, in terms of you and your members, that schools should partially open the way the government has described at the beginning of June?
There isn't a school leader that I've spoken to that wants to delay expanded access. Excuse me again. I hope I haven't come down with something.
God forbid, yeah.
So there's not a school leader that I've spoken to that doesn't want to expand access to schools. I think the problem is how quickly you expand that, and the underpinning safety requirements and the underpinning science for that, which is still very, very blurred. I was talking to a doctor just at the weekend about children spreading the virus to adults, and there seems to be a conflict between what's being said in the advice that we've had overnight and medical advice.
Okay, so in a nutshell, what would you like to see before you and your members' anxieties were removed about partially opening primary schools on the 1st of June, in a nutshell?
Yeah, I think it's an open conversation about the art of the possible. And establishing exactly what the underpinning science said, what medical advice is, and then what can we actually do according to that.
Just going back to my earlier question, the Sutton Trust suggested that only 45% of students had communicated with their teachers during lockdown, and only 8% of pupils in the least advantaged state schools have been returning work set by their teachers. Do you recognise those figures, and what does this tell us about the scale of the problem, if you do?
So that the figures that we've had back just in the last couple of days suggest higher levels of contact than that, and I will furnish the committee with the full set of figures when we've got them. The thing we're struggling with most is the new relationship between school and home, and the amount of work that takes place in the home. Some of the things we've picked up recently actually is parents' renewed understanding of just how difficult the profession is, and how difficult it is to teach children and getting children to engage in the work that's being set. So there's no shortage of work being set, there's no shortage of online availability, but getting engagement is the task that we need to improve upon. And remember, this is a completely different discipline to teaching in the classroom. It's a whole order of new complexity, and actually in some respects those figures are quite encouraging, that it's that high within a few weeks of starting and hopefully improving.
Okay, and as I reiterate, we recognise the incredible work that many teachers across the country have done and support staff, of course. Can I just, before I bring my question to Emily, I think David Simmons and Tom Hunt want to ask a question. David Simmons, are you there? Yeah.
It was the question you asked, Chairman, about why some schools seem to be able to offer a much more comprehensive curriculum than others. So I think it's been covered in Paul's answer. Thank you.
Thank you. Tom?
I mean, it's obviously, in terms of that, some of that data, it's obviously very concerning that apparently only 8% of children from deprived backgrounds are supplying work that have been set, which I think probably demonstrates the limitations of learning packs, really, and the importance of online learning during this period. Online learning clearly has its limitations, but it's better than nothing, and it's important we get attendance rates high. I mean, it does concern me. I mean, there's not as much data available at the moment as we'd like, so we do naturally monitor the national media, and we do see quotes in there from teaching unions, etc. So it does concern me slightly when I read from a quote from the NEU in the Telegraph saying, "Do not expect teachers to live stream lessons from their homes, nor engage in any video calling, except in specific special circumstances. It is not possible to recreate the classroom in this way, and the NEU has advised teachers not to do so." I mean, it concerns me that one of the major teaching unions, if that quote is accurate, which I imagine it is because it's in a national publication, are actively discouraging teachers from taking part in online learning. And if they are, perhaps that bears truth with some of the very concerning figures from the Sutton Trust about low levels of online engagement.
I obviously can't speak on behalf of the NEU, and I don't know the context of the quote that they gave in that respect. But our experience as school leaders is online learning isn't just about video lessons and video calls into homes, and there are some very real safeguarding issues about being into a child's home from your own home and how to take those lessons as well. So there's some issues there to talk about. And this, as I say, this is a whole new discipline that we've developed in a matter of, if you think we're 7 weeks in now into our 8th week, the first couple of weeks were spent closing schools down to the majority of pupils and making arrangements for the vulnerable children that need to come in and the children of key workers. So we've completely changed the discipline of education in a matter of about 5 weeks, and therefore learning new skills and learning new ways of delivering online and through learning packs is something that's in its infancy, but it's something that we're going to have to continue to work on, because if we're looking at phased returns and not whole access to school, then the relationship between school and home is going to necessarily be a different relationship. So this is a conversation that's going to have to continue beyond the 1st of June and probably beyond the September arrival back, as everybody would hope for.
Thank you, Paul. We'll give you a rest for a minute so you can get some water if you need it. If I could just come on to Emily from the Safeguarding Alliance. You've publicly identified what you call a new frontier of vulnerable children that are outside the government's existing category of categories of vulnerable children. Can you explain what you mean by that and what you think is happening to vulnerable children during the coronavirus?
Yes, of course. So in response to that, Robert, in which we describe the new frontier of vulnerabilities, it's those children who don't currently meet the definition. So they may not be deemed vulnerable due to having a social work involvement or looked after child or an SEND requirements, but those children, it may be due in response to COVID-19 that they're facing difficulties. New difficulties, echoing on from what Barnardo's have said. These are new vulnerabilities that haven't yet been identified. Children living at home with lack of internet access, children experiencing mental health crises for the first time. These are the new vulnerabilities that we have an increased concern around. And
what do you think should be done about it? I mean, should the government have some additional categories? What should be done specifically?
I believe it's about delegating the power to the schools. So the schools are working with the pupils. They know their pupils best. They're working with them on a day-to-day basis. In most circumstances, schools are working with pupils over 39 weeks of the year. And I think it's important that where a school is identifying a pupil as being vulnerable, even if they do not fall within the definition of vulnerability, support services are still available based on the diagnosis of the school itself.
And are you doing any surveys or getting help with data of the new frontier of vulnerabilities in terms of vulnerable children?
Yes, so we're currently working with a number of schools across the country. An example being obviously the technical support that was very greatly offered by the government. It's a fantastic initiative, but we're seeing, again, going back to the definition of vulnerability, it's those children who do not fall within that category of vulnerability who may not be able to access such support. So, for example, we're in discussions at the moment with a trust who have 8,000 pupils, and they've only been able to obtain an allocation of 28 laptops for pupils.
You've talked about exposure to online harms. Could you just explain further?
Yes, of course. So obviously in response to COVID-19, many pupils will be currently educated online. And with that brings a whole host of safeguarding concerns. So for example, it's a well-known fact that with the high increase of pupils online, potential predators will be well aware of that, will also be accessing online facilities in order to potentially speak to children. My other concern comes as well is, whilst lockdown was in place, those threats are essentially possibly not immediate threats, but when lockdown starts to be lifted, relationships potentially could have been formed with those pupils on an online basis, and then essentially predators could start meeting up with children subsequent to lockdown being lifted.
Thank you. I'm going to pass over to Ian now, please.
Thank you very much, Chair. Paul, can I ask you a specific question first in regards to the return to schools? What specific consultation did the DFE conduct with the NAHT about the return date, the proposed return date that the government have come up with this week?
So we've been engaged with the department on a regular basis over the last few weeks to talk about the worries and the barriers, but specifically over the date and the year groups that were suggested in the last 48 hours. No, we haven't been consulted on that specifically. But as I say, there have been much more general conversations on an ongoing basis.
And with regards to appropriate social distancing within schools when they return, you've mentioned it, that the 15 number of pupil group sizes might be problematic for many schools. Even the 10 or 12 that you've mentioned might be problematic for many other schools. I've got local schools where head teachers have suggested 6 or 8 maximum, given on the size of classrooms. Would you concur with that?
So each individual school is very different, and each school is unique actually in terms of its buildings and how it will work. If social distancing is, as we understand it now, the 2-metre rule to be applied in schools, there are very many schools that are saying it's simply impossible to achieve, whether that's 10, 12, 6 or 8. So there's a whole kind of breadth of challenge that we have there. We're also learning from other countries as well in terms of the return, that some of the things you'd need to get into school to achieve social distancing, such as more sanitary facilities, more toilets and things like that, there's a huge lead-in time to get those to be delivered beyond the kind of 3 weeks that we're looking at for the 1st of June. So social distancing is going to be a massive problem. One of the things that is more of a worry as well is there's a bit of a debate right now about whether social distancing for younger children is different to how it's more broadly understood. And if social distancing is going to be described in different terms for schools, we're going to have to really understand on what basis it is different to give confidence to parents and give confidence to the sector. The rules aren't just fitting the problem, rather than us trying to discuss the art of the possible, considering the advice from the scientists and the clinicians.
Is there any specific educational rationale that you can think of in terms of the year groups, particularly in the primary sector, which have been selected for the early return with reception year 1 and year 6?
So yes, there is. I mean, in terms of early development, that's very important. And in terms of year 6, it's important for transition. But that said, you can mount an argument for the educational value at year 5 to be just as important as year 6 too. The worry about the younger year groups is, yes, of course, we argue strongly in normal circumstances the value of that early education. But it's also those groups that are most difficult to achieve social distancing with, and it's those groups that it's the most difficult to achieve the levels of hygiene in terms of hand washing and contact with adults and other children. So there's a real balance to be struck there, and it's one that we really need to understand the advice that it's based upon going forward.
Right. Given the different levels of contact which have been achieved by schools across the country, how might schools avoid stigmatising disadvantaged children in their efforts to support them catching up and in their return to the classroom?
So this is going to be a real challenge going forward. We know that children that are defined as vulnerable, the definition of vulnerable is unhelpful in the first instance in any event. There's a lot of children that would qualify as vulnerable that actually aren't vulnerable in the physical sense and need to find school as a safe haven on a daily basis. So that the difficulty of stigma is a very real one. And I think we need to change our language around this. We need to change our language to one of priority rather than one of vulnerability, although it will be driven by vulnerability in some senses. So we need to make sure that we remove the stigma as far as we possibly can. But importantly, what we're seeing in terms of the reply from our members isn't that vulnerable children just are failing to turn up. The parents of these children are taking seriously the stay-at-home message from government and are holding their children back through the similar fears of exposure to the virus, safety concerns for their children, and all the rest of it. And we're going to have to persuade the parents of those children and those families as much as anybody else that there's enough confidence in the system. And as I was saying earlier, there just simply isn't enough understanding of the scientific basis for the return for that confidence to exist right now.
I think one of the major concerns of everybody out there is that the prospect of asymptomatic transmission of the disease, and with that possibility, how does one tell who's a risk and who isn't?
So we understand the transfer not only between children and how children suffer the disease, but the transfer between children to adults, and the science on that is very competitive. As far as we observe it right now. I've seen competing science over whether children transmit the virus to adults or not. Now, if there is a significant chance of transmission between children to adults, and then adults into the wider community and into households who are shielding and all the rest of it, then that's a real difficulty that takes us back to the social distancing measures within schools that are so difficult to achieve. So that's what I keep talking about. I'm not an epidemiologist or a clinician, but I do want to understand what those people are saying about it so that we can understand what social distancing is necessary and whether it's possible within the school setting.
Emily, have you anything to add on any of that, please?
Yes, I completely agree with what Paul was saying. I think it's about conducting a robust risk assessment, both for a health and safety risk assessment, but also taking into consideration the safeguarding and well-being impacts of the children as well. It's not just a case of coming back to school, the physical restraints of social distancing. Many children have been in isolation now for a number of weeks, haven't had any outside contact with their peer group, pupils of their own age. It's going to take a lot of integration for getting those children to come back, and also getting parents and carers to feel comfortable sending their children back as well. I think that's a huge consideration that must be thought of as well.
Just to be clear, are you saying, both of you, that in terms of the 1st of June opening, that you believe that the jury is still out and you're not yet clear about the science and medical advice, and you need further conditions to be met before you think it's right to open them on the 1st of June? Perhaps I can expand on my answer first. So as we understand the requirements of social distancing today, we don't think that's possible in terms of the return that's outlined in what we've heard overnight and the day before. We are still getting to grips with, frankly, the advice that was released late yesterday afternoon. So we're getting into the detail of that, and we will be able to respond more to that later on. But I think the real issue here, as much as anything else, is the very important bond of trust between school and family. And that's even more important for families of vulnerable children. They have to trust school. And if school leaders and teachers are in a position where they're not quite sure of the basis of the return and the amount of risk that's being assumed in the school setting, devoid of the trust that's out there at the moment. All of the survey data that we're getting at the moment is that the vast majority of children's parents at the moment that don't have the confidence of a return around the 1st of June. And if you're going to fill that void, then we need to understand the underpinning science. We need to understand the medical advice that goes with it so that we can then determine whether that's possible within the setting or not. Ian, have you finished? Emily, did you want to add anything?
Yeah.
I was just going to add on that note as well. I think it's about balancing the safety of the child both in the home and in the school for return for the 1st of June. It's not just going to be a simple case that schools open on the 1st of June and pupils will start to return. There's a lot of assessment and planning that's going to take place, and both for pupils, parents and teachers, if it's going to be done properly. If we're looking specifically as well at the early years, many younger children will be completely immersed into family life. And they will be going from an immersion into family life into a potential setting where there may be limitations for social distancing, and how that's going to have longer term effects on the child themselves. And I think that's really important to consider.
Thank you. Before I pass to Jonathan, I know you're waiting patiently. I've got a question from Caroline Johnson, who has technical difficulties, a member of our committee. She was contacted by a constituent this week who's described her 2 daughters at 2 different senior schools locally. One is doing online lessons, marking and returning work and chasing work not submitted with parents directly. The other daughter is being set work by email. No online lessons are provided. Work is not for return or marking in the vast majority of cases, and parents and child are not sure if the work is correct. The mother is very worried about how to help the second child. Caroline Johnson says that she recognises that schools and teachers are working really hard on this, but how can parents get further help if they need it, and how can schools work together to learn from each other?
So schools are in contact with the vast majority of families. So if there's concerns like that being raised, my advice would be talk to the teachers that are in contact and the school leaders that are in contact. The differences in approach will be necessitated by the different circumstances of each individual school and the approaches that they've taken. Now, the vast majority of work being set, whether it's learning packs, online learning, or whatever it is still closely aligned to the curriculum that the school has adopted. So there should be a direction of travel that's known to both the child and the family, but actually be in contact with the school. I think there's a bit of a picture, an unfortunate picture being painted at times, that there's a lot of teachers sitting around waiting for someone to come back to work. That isn't the case. Teachers are working incredibly hard from schools and from their homes to deliver learning. So if there's something that seems to be missing, talk to the school and get underneath what more can be done. But as I say, this is a completely new discipline to parents and teachers and schools about how to deliver learning in this way. So we need to learn together and build an even deeper coalition between family and school.
Thank you. Emily?
I think as well, I think this just echoes the fact that there is not one response to learning for COVID-19. Every school will do things differently based on the needs of their pupils, staff, and parents and carers situation. And I think that's really important when making any directions or guidances from the government, that it is taken into consideration that based on geographical differences, that there is the requirement for a different response.
Sorry, Jonathan, very, very quickly, Tom, if you could do it quickly, if I bring in Tom and Dawn.
Making this point, but I am concerned about some of the points made by not just one teaching union, but actually quite a few. Clearly, it's absolutely reasonable for parents to have concerns about sending their children back to school right now. And there's a number of questions that need to be answered. But I mean, does it concern you as somebody very senior in a teaching union that a senior teaching union has effectively ruled out any kind of opening before September, presumably even if their concerns are met?
Sorry, I missed the first part of your question. It wasn't coming through right from the start. Sorry.
So does it concern you that a major teaching union, the NASUWT, have pretty much ruled out supporting any kind of opening before September of schools, presumably even if concerns around safety, reasonable concerns around safety are met?
So there isn't a school leader that I've spoken to, or a teacher either that I've spoken to, that wants to delay a return to school for any longer than is absolutely necessary. That the drive from everybody that I'm speaking to at the moment is to understand the level of risk that the government is asking schools to assume, quantify that, risk assess it, and then fully mitigate it. And what we have, and I think that's entirely reasonable, not just for teachers and school leaders, but for the children that are coming in to protect the care for and for the communities that they serve. And I think that's where the difficulty lies right now, is that there isn't the depth of understanding around that that's necessary to then breed the confidence into the whole of that school community that we can do this successfully. So I think there's a lot of talking to be done over the next few hours and couple of days, actually, to get underneath what it is we're being asked to do, even around those basics of, is it 15 in a class? Is it 6 in a class? What is it that keeps everybody safe? And then what is it that schools can actually deliver?
Thank you. Jonathan, you've waited a long time. And then Dawn.
Thank you, Chair. Thank you, Chair. And just to declare an interest, for what Tom mentioned earlier, I am still an associated member of the NSUWT, having been a frontline teacher since leaving university. Obviously, we've heard about whether schools should fully or formally reopen. The key question for me, and I've had, like, for example, Lauren and Beth in my constituency of Stoke North, who are year 12 students and are feeling very anxious about missing out on key learning. What do you think should happen over the summer holidays? I'm and this is for both of you, by the way, because I'm personally someone who thinks that with those key year groups, let's say your year 5s, as you mentioned earlier, Paul and Emily, but also year 10 and 12, I think schools should be open over the summer holidays to let those children do get some sort of catch up, because those exams next year are going to be critical to their futures.
Should I go first? So there's a superficial attraction to that. It seems a very simple answer to the amount of time that's been lost. I think there's a lot more depth to the question that would need to be considered. So schools have been operating, and many children are still learning. And we're already beginning to get reports from children actually about the levels of fatigue that children are suffering, which might not be caused by the amount of learning they're doing, but just the situation that they're dealing with. The emotional fatigue that children are suffering right now is something that shouldn't be forgotten. So there's an issue there. And actually some of the readjustment that we discussed with the panel earlier isn't just necessarily about an educational readjustment, it's a readjustment and a readjustment to socialisation with others that will take some time before any educational benefit would come through. So there's some difficulties there. I think the other issues that we need to be concerned on is beginning to understand what it is that would normally be delivered in the September to Christmas term, which is normally the most pressurised term for children and for students. And actually, the amount of educational advantage we normally get in the last couple of weeks of that term is diminishing anyway. If we work them through the summer as well, then actually what superficially looks like an attractive proposition, we might lose towards the back end of that term in any event. So I think it's a much more complex picture. The amount of planning that will be needed for the September term will be increased as well, because the education will be being delivered in a different way. And if we're educating throughout the summer and then planning for a different delivery of education from September to December, when does that take place if that's all taking place over the summer as well? So I think there's superficial attractions to that, but there's a whole order of complexity below it that would have to be considered very, very carefully before plans are made.
Yeah, I agree with that. I think in terms of over the summer holidays, I think the question needs to be what they're going to be doing over the summer holidays. Is it going to be a case of children and pupils are going in to be educated and receiving a form of education, or is it going to be in the form of a care setting? Because I think they're very two separate things. I think what Paul was saying is correct. During COVID-19 and home and remote learning, pupils are still learning at home. They're not, the vast majority are not sitting at home. They're still undertaking a form of education. And I think it's important that staff and teachers don't have a burnout over the summer holidays, and also pupils as well. We have to take into consideration their well-being needs above anything.
I mean, I would come back to you on that point, because we've heard the data that there's a lot of kids who, especially in the state sector, aren't interacting or engaging with the learning online. And I have a huge fear of the amount of learning that is being missed at this present moment in time. And I know you guys share that. And of course, I understand the importance of not fatiguing children unnecessarily. I understand the importance of teachers. Look, I was, like I say, one myself. I know those 6 weeks were vitally important to recharge the batteries. But I just think if we have any chance of getting the year 5, 10s and 12s caught up in any shape or form, and actually probably those reception in year 1 maybe as well, which is, you know, we know those early years are so crucial to a child's learning, then we're going to see a whole generation failed and left behind. And, you know, unlike the current year 11s and 13s who have got, in some ways, a slight advantage with the fact they're not having to sit exams, obviously they may or may not be happy with the results that come in. I just fear there's a real gap there. But I do agree that, you know, this would, of course, it's fancy land what I'm talking about in some regards. You can't just open them up. There has to be a lot of research into it to make sure it's scientifically safe. And I agree that there should be an element of academia, but also care for disadvantaged pupils as well, or pupils who are suffering from maybe that mental fatigue that you mentioned. But I just feel that the school is the safest place. School is the building that they feel safest in for a lot of these vulnerable children. And, you know, we need to do everything we can to catch them up. So, you know, just to sort of, that's my comment, as it were. And then my final question is, obviously there is widespread concern about the disadvantaged pupils and that they will fare disproportionately badly from school closures. What should we do right now to ensure they can catch up?
So, if I can take that one. With regards to the online learning, just because some pupils obviously are not accessing online learning, it doesn't necessarily mean that they're not undertaking learning at home. Many schools are providing physical packs for pupils whereby they don't have the internet as a means to communicate. And on the second point, I completely agree. A school building itself is, in many eyes of many pupils, the safe building. That doesn't necessarily mean that over the summer it needs to be teaching staff in the school buildings undertaking the teaching. It could be through an engaged partnerships with charities such as the Diana Award or the Place to Be, other charities, and creating partnerships there to come in and support those pupils, both for the wellbeing element but also from an academic level. And in response to the disadvantage, I think it then goes back to categorizing what is classed, what pupils will be classed as being disadvantaged in response to COVID-19. Because many families would argue, even those who aren't technically classed as being disadvantaged, are their children not disadvantaged in response to COVID-19 without having any other additional vulnerabilities for the mere fact that they're having to be educated at home, their social distancing. So I think it's about considering the wider remit of disadvantages in response to COVID.
I think all I'd add to that is, you know, everybody's seized of the of the apparent problems that have been caused by the lockdown and the restricted access to school. So I don't think anybody disagrees on the problem. I think it's finding the right solution. And the worry that we have actually is that superficially attractive methods of doing this could actually come back and not make up the ground at all. If we overload students and overload their teachers, actually the amount of advantage we get declines the longer we go into it. And I think it's worth remembering that no one's had a proper break really since Christmas. That's teachers and their students, in that they would have had a half-term week, but a lot also took work through the normal Easter closing period as well, to make sure that this new discipline of teaching children at home was getting as developed as it possibly could be. And I think we need to remember that this is a whole new discipline. No one's trained to deliver education in this way, and we're getting to grips with it as a very new thing, and that can continue. So there's lots of answers, but I think the simplicity, and I understand the attractiveness of the simplicity, but I just think that we'll have exhausted children and exhausted teachers in schools in the back end of the year, and we'll lose just as much then as we've lost in this period of close down.
Dawn, thank you. Been waiting.
Thank you, and thank you both very much for your responses and all of your work. There's obviously a lot of infrastructure that needs to be put into place to make sure that children are able to catch up after COVID. Can I just drill down on PPE? It seems that what you're saying, that you don't have the correct facilities to be able for teachers to carry out their jobs effectively, efficiently and safely. And once schools reopen, teachers will become the frontline workers. And we know that kids are in the main asymptomatic, and we know that there are different strains of COVID. And so the teachers will be exposed to all of these different strains of COVID. Do you think that teachers have or any PPE to be able to carry out their job as a teacher safely? And does it differ in schools? So do special schools need, special schools with children with special needs, do they need additional support and PPE in order for them to carry out their jobs? Because I think 5 or 6 weeks is just not enough time for you to prepare what's needed, but it'd be good to just find out from you, do you currently think that there's enough in place? And what do you think needs to happen going forward?
So if I can take the special schools point first of all, We've had particular difficulty in special schools, especially in those schools that are caring for children with profound needs, where some children spit, some children need more intimate contact with teachers, and we've had the perverse situations sometimes where medical staff in those schools are provided with PPE because they're told they need it, and teachers aren't because they're told that they don't need it. So we've got some real difficulties there, and we don't really have a medical advice or the scientific basis for that difference going forward. So we need to understand that, and I'm going to keep coming back to a lack of understanding in the educational setting about what is recommended. Getting into mainstream schools, there isn't any PPE, and any teachers that are wearing PPE have obtained it for themselves and are doing it on their best estimate of what is necessary going forward. And one of the things we keep asking government to do is, if they're convinced that PPE isn't necessary, explain why. It's necessary for intimate contact everywhere else. And if there's a credible explanation as to why it's not necessary, then I'm sure the teaching profession will accept it. But on Friday, when I was talking to clinicians, they were absolutely clear with me that children have a similar viral load to the rest of society, and they can transmit the disease the same as everybody else. The only reason that it's slightly different is actually the height of children in comparison to an adult with a sneeze or a cough and all the rest of it. Now, if that's competing science, we need to understand that it's competing science, and then we can understand the risks and mitigate them depending upon what government asks us to do. So it's a very long answer. The summary of it really is, we don't know what PPE is needed, and none is available for schools right now anyway.
Well, yes, I think the question is obviously if it is required for teaching staff to wear, it's the practicalities. Will PPE be made available to teachers? If so, I know it's a small consideration, but what happens to children with allergies, such as latex allergies? Will there be gloves provided, for example, to teachers that are latex free? And I think there's a whole host of considerations that must be taken into consideration when we're looking at PPE for teachers. And again, if the government's saying that it's not required, there needs to be firm evidence as to why.
Dawn, do you want to come back?
No, just thank you both very much. And as I say, we lost 200 doctors very early on the front line, exposed to different strains of the virus. And I think the next bit will be teachers will be on the front line, exposed to different strains of viruses. So thank you both very much.
Just on the back of Dawn's question, just to be clear, should there be a much stronger PPE guidance for teachers in who are vulnerable settings or looking after children with behavioural difficulties or more?
Yes, I think it's a simple question. Answer of yes.
Thank you.
I think as well, I think it's not just working with children with behavioural difficulties. There needs to be guidance for all teachers working with all children, because many teachers will concur to this, that there may be an occasion where a child is sick in school or is unwell, and a teacher is going to have to tend to that child. There needs to be guidance for the whole of the teaching profession.
And Paul, do you feel the guidance is not strong enough at present or not clear enough?
There isn't any real guidance right now, other than we're told that PPE isn't necessary and washing your hands with soap and water is all you need to do. And that may well be the case, but no one's explained why, to give sufficient confidence in the school setting.
Right. And do you have regular conversations with Public Health England and the medical officers?
Through the Department for Education, we get information that way. We are hoping to meet directly with Public Health England going forward.
Okay. Thank you. David Johnston.
Thank you very much. There have been, so this is to both of you, there have been suggestions that we should get graduates to join schools, we should get retired people from the profession to come back to schools to help with this. I wonder what you think about the idea of schemes like that, and if they happen, how you would best use them.
So I'd refer back to the answer I gave about the summer to some extent, and that we can't overload children over the summer period, and we can't overload children with too much learning. There's only so much so much capacity that they have. I think superficial. I mean, one of the problems that we have in education is a recruitment and retention crisis anyway. So there's not enough teachers around. So access to to former teachers has a superficial attraction to it. I think one of the worries there, though, is if they're retired teachers, would they naturally be more aligned to the vulnerable groups that we're concerned with at the moment and putting them in front of children who may be carrying the virus and be asymptomatic? So there's some very practical issues about how many people would be available to us in that sense. And then some planning issues about making sure that what's delivered by those people is in line with the curriculum of the school and everything that's needed. So it's not a rejection, but I think it's slightly more complex. I think in terms of using graduates or undergraduates, they're not teachers. And I think parents are discovering very, very quickly that teaching is a skill and it is a profession. And getting children to engage and to deliver education in the right way is quite a complex task. And therefore, it's not as simple as just finding people that are willing. It's finding people that have the skills to do it properly. Otherwise, we will compound some of the issues that are arising through the lockdown.
Can I just bring in Kim, because we missed her question. Kim.
Thank you, Chair. We've had a discussion this morning about vulnerability and how it's not useful at the moment, given that some children, as a result of coronavirus, are likely to be classed as vulnerable due to poverty, food insecurity, and mental health. So my question is to Emily. How effective have schools and social work teams been at chasing non-attendance of vulnerable children who are expected to be in school?
So we've seen a lot of schools that we've been working with who have been undertaking daily welfare calls to pupils who have been offered a place who haven't attended. In some instances, we've been in contact with a head teacher who has personally been making home calls, physically going to the home to check on the child. I think it's a case of, it's not just about those children who were offered places to the school due to vulnerability. I think it goes back to this new frontier of vulnerability. There's many children who are vulnerable in the home who weren't eligible for a place at school because they weren't technically classed as being vulnerable, who teachers have considerable concerns about. And I think it's about assessing all aspects of vulnerability around the child.
Thanks, Emily. And how easy is it for schools to get in contact with social workers and children's services to discuss these concerns, particularly as we've heard there's been an increase in domestic abuse, and children will be affected by living in those environments?
Okay, well, if we look at the national statistics characteristics of children, the data from 2018 to 2019, there were nearly 400,000 children in need, and 53,000 children subject to child protection plans. So that's over 450,000 children previously known to social services. They are under a huge amount of pressure, and obviously there is a capacity issue. I think what we're seeing is the schools have always been the hub of maintaining contact with pupils, and they maintain to do so. And I think they are absolutely pivotal during COVID-19, and they're key to the safety of children. And I think it's about delegating more powers to the schools in such situations to identify and make the required changes necessary to safeguard the child during this time.
Thanks, Emily. Final question. A lot of schools have suffered as a result of 10 years plus of austerity. So given the pressure on local authority children's services teams, are they having to prioritise children most at risk at the expense of those who may need a lower level of support? And what would be the consequences of this?
I think the consequence would be is that potentially a child would be missed off of the statutory radar. If we look at the key documents for safeguarding children, working together to safeguarding children, keeping children safe in education, every aspect makes remarks to early intervention, and the schools are the one who are picking up on the early intervention, making the referrals. I think the issue is that there is a capacity issue. COVID-19 has seen that there are so many more children being vulnerable because they're living in a household potentially with domestic violence. They are suffering mental health and well-being issues because they've been at home alone, social distancing, isolating, potential online safety considerations that we have to remember as well. And I think what COVID-19 has done, it's in essence hindering hindering the early intervention that schools do so well because of a capacity issue.
Thank you. Thank you.
So can I just add to that? I mean, it's absolutely correct that schools are the centre of identification and then reference to other agencies that they work with for children they're concerned about. And school leaders and teachers have been making contact with homes during this period that they're concerned about. And 60% of our members replying to our survey have made referrals on during the period of the lockdown as well. So you can see the pressure that's there. It was difficult. Social services were under huge pressure before this and under even more pressure now. So the access to social services isn't any easier. The one thing I think we need to take care about going forward is if there is a discussion about the expansion of the role in this regard for teachers and school leaders, is they shouldn't step outside their expertise or their competence. There are very specialist things that social services do that teachers shouldn't be expected to do, because if we do that, we could cause dangers that aren't currently there. So it's a multi-agency approach that we need to maintain.
Thanks, Paul.
Thank you. Have you finished, Kim? Is that thank you. Jonathan wants to come in. Jonathan Gullis wants to come in, please. Can we unmute him?
Sorry, thank you, Chair. It was to come back on to David Johnson's point made earlier on. We've seen this call for an army of volunteers, both within the NHS and within the social care sector. I am here as a former teacher, begging to go back into school in my constituency and help out where I can. The issue I'm facing, for example, is having to go through a lot of paperwork and process in order to make sure that, the correct safeguarding checks are in place. Now, I totally get that. Obviously, we can't just have, Jonathan Gullis off the street with no teacher reference number, but there's something needs to be done to allow people like myself to come back into the school without having to go through every single school and filling in paperwork. So I was wondering if Emily from, what you do in the Safeguard Alliance, but also Paul from the NAHT can help it sort of put the pressure on this so that we can go back into school, whether that be people who left the profession or retired or have gone into new careers, can come back and help in some small way. Because I'm finding it incredibly frustrating that I have to fill in a form for every single school and go through a safeguarding check in every single one of those.
Yeah, so I in response to that, I completely agree. I think there needs to be a portability of safer recruitment in response to COVID-19 and how we look at bringing in that army of volunteers. For example, it could be trainee teachers, trainee social workers who would have already undertaken a DBS at the start of their course, and potentially could look at using their summer work as part of their credits to obtaining their qualification over the summer, because obviously they themselves would have missed out the potential to undertake the necessary requirements that they need to pass. I think as long as the appropriate robust safeguard checks are in place for every single school and every single army of volunteers, I think it is a good idea. I think the key message of this is that it has to be done safely. What mustn't happen is, in response to the COVID-19 pandemic, that we turn into a child protection epidemic. So I think it's absolutely paramount that, yes, there is that portability. So, for example, the DBS, having all schools having access to the update system. I think that it's possible as long as it's done safely, because there are many volunteers out there who are, like yourself, really raring to go and support schools over the summer.
Thank you. Paul.
So I won't expand further on the safeguarding aspects of that. We have to be content that children are properly protected, no matter what arrangements or modified arrangements are in place. I think the worry about the army of volunteers is that we can increase the capacity of those willing to bring education into schools and bring support to schools. But that doesn't increase the capacity of children to learn. And there's a real key concern that we overload children over the forthcoming period, and actually their ability to catch up is restrained by their ability or their capacity to take information in. So we might have a mismatch there between those willing to step in and the ability of children to work as fast as we might have the ambition for them to do so, to catch up what they've lost over.
But sorry, Chair, very quickly. Hold on, please, Jonathan. David Johnson, do you want to come in? Because it was your question.
just going to say, Paul, is your position that actually schools will not need any more people to be able to deal with this? So they might need more money, but it sounds like you don't want the graduates, you don't want the retired. I'm getting the sense that probably you think they can cope with the people they have, notwithstanding the sort of teacher recruitment issues where you've got vacancies filled. Is that right?
No, I've probably overplayed the point. What I'm saying is it's not a rejection of volunteers or help coming into the sector, but it's very careful consideration about what it is they're being asked to deliver and how that's being delivered. So on the face of it, it looks like plenty of people coming in, we can make up whatever's been lost over a short period of time, but there's much more consideration to be made about how the children's capacity to react to that and the organisation of it. So if I've overplayed the point, then my apologies, but I don't think it's as easy as the headline would sound, that we've got volunteers waiting to come in.
Okay. Sorry, Jonathan. Yeah, sorry, Chair. On the last point on this, I promise. Paul, my fear is, right, we're talking about overloading children. The last thing we want to do is create, even more pressure on CAMHS and other mental health services. I was a former head of year. I understand the difficulties that many children are going through. But my fear is that a lot of children also benefit massively socially and mentally from, one, having the routine of school, and two, actually having a chance to see their friends, in a setting, yes, 2 meters apart in some safe way. So I have a huge fear that, at the same time, whilst it's, of course, the health and safety comes first, but I think we're underplaying actually how resilient young people can be, but also about the benefits of them going into an education setting in some regard and being amongst their peers and staff members. And that's my only fear with this, is that we're not looking at it from the positive angle, we're looking at it just the negative.
Could I just add to that before you answer, because it's related? I mean, Michael Wilshaw, the former Chief Inspector of Schools, as you know, has said that there needs to be a big catch-up programme for children, and they should possibly come in on weekends and in the summer. Now, whilst I accept that schools won't officially be open in the summer, I understand that. Why on earth couldn't one have summer schools to help these young children catch up, both in terms of pastoral care as well as in education, if there were voluntary tutors and charities, existing charities that are already on the ground, helping these children reorientate themselves and have some learning and pastoral care?
Yeah, so the concept of summer provision through schools, which is something that happens regularly anyway over the summer in terms of access to school, isn't something that, if it sounds like I'm rejecting that, that's not the position. And I think there's a whole difference between access to school buildings and access to the social settings, which will be necessary for reacquainting children back to the setting and socialisation and everything else. That's part of one of the worries that we have. It's not just about education, it's about the whole route back out of the crisis from home into the school setting. So not rejecting that. My answers were more akin to this idea that this army of people can catch up the education that's been lost, and it's not as simple as that. It's much more complex.
Emily?
I think as well it's important to reiterate the fact that schools do not just educate. I think what Jonathan was saying as well, they provide, it's the pastoral care as well as the academic provision that they provide as well. And a summer school programme with the safe support of a volunteer of armies would be a good idea in terms of reintegrating children back into school, ready for a September whole school start.
But thank you. Just you don't agree with what Michael Wilshaw said about needing weekends and extra catch-up, Paul? Is that right, or have I misunderstood you?
Well, I think that there's two separate questions being debated here. It's access for pastoral care and access for re-socialisation and everything else, and then there's the catch-up question. And with the catch-up question, there's only so much education children can take in one go, and there's the concept of fatigue for them as well as everybody else. So I think there needs to be a whole lot of care in planning how that takes place, not to overload children and cause unintended consequences further down the track.
Jonathan, do you want to come back on that at all?
No, I just think that I totally understand the complexity with this. I am with someone, it won't surprise my committee members, I'm Michael Wilshaw kind of esque mindset that, to catch up, this is going to involve a huge effort. And I just think those transition years and those exam years that are going to be in the 2020-2021 academic year are going, my fear is they're going to be failed. Because as we know, when kids are taught the curriculum, different curriculums, or sorry, different orders of curriculum are done in different ways in schools. And when it comes to writing these exams and then putting in the grade boundaries, it's going to be an absolute nightmare. So for me personally, I think that the only way we're going to get close to solving this and allowing the catch-up time for curriculum teaching is going to be through some sort of part-time, stagnated over the day, however it might work, summer school program for those key year groups.
Okay, thank you. Ian, finally, you've been waiting. Thank you.
Right. I think that you might have heard of a company called Edenred, Paul. And I'm just wondering if there are any particular lessons that can be learned from the government's efforts to put into place a national free school meals voucher system in a short space of time, and was there an over-reliance on this system by schools when perhaps, as has been suggested by ministers, alternative local arrangements would have been better to support their local families in need? Or was that supposition of an alternative local arrangement totally contingent on appropriate funding being provided?
So this is a really difficult issue. Now, when we were talking about the launch of the free school meal voucher system with the department, I left those conversations with the very clear impression that this was the preferred method for delivery of vouchers to families that were entitled to them, and it should supersede any local arrangements that were being made other than if schools were still cooking in their own kitchen or delivering food from the school. So that was a clear understanding we left with, and I think that's why Edenred were overrun with demand, because it was the central point and the preferred method of delivery for free school meals vouchers. I think since then there's been some discussion about whether that was the case or whether it was a replacement if you couldn't make your own local arrangements. But I was very, very clear, and looking back over the press releases and the advice at the time, it was the preferred method of delivery. And just underlining that is the funding, the emergency funding available to schools has very specific limits on it, and you could access it for delivering free school meal vouchers if you needed to locally, but the spending for free school meals wasn't red circled within that limit, so you could exhaust that provision and have nothing left for all the other costs that were coming in. And when we asked the department to red circle so that our members could sort out local arrangements, that wasn't forthcoming and still hasn't been forthcoming. The reliance was upon the Edenred delivery. So I think the big learning points there are at no extra cost to the Treasury. Schools could have made local arrangements, had to make local arrangements anyway, and would have done very successfully. So a better understanding about the positioning of the voucher system, it was probably lacking, and that was its failure.
Can I ask, have you had any discussion with the department about if the voucher scheme is going to continue through the Whitsun break? Or have you had any information on that? Because we've been discussing that earlier this morning.
Yeah, we would certainly like to see it continue because of the impact, but we haven't had any in-depth conversation with the department about that and what their attitude is as now.
And would I be right in saying that the more than just initial teething problems in terms of getting the scheme sorted out have to a large extent quieting down, or is this scheme much more accessible now than it was in those initial few weeks?
So the last data that we had is a week old now, so it could have improved this week, but there was certainly a claim from the provider that all the wrinkles had been ironed out at the time we took our last data, and that wasn't the experience on the ground. Now, that might be explained away by a lag between what's seen at the centre and what's experienced on the ground, but certainly every school leader I still talk to is still complaining about the provision.
Yeah, and you know, it's an expensive scheme. It runs into a couple of £100 million involving the company Edenred, and I think a good look at how this has been actually facilitated across the country, because there have been some unfortunate situations where schools have managed to secure vouchers for parents, and then the parents have turned up at supermarkets, got their shopping, and actually been turned away at the checkout because the vouchers wouldn't be validated or redeemable.
Yeah, I think it's worth saying just very quickly schools locally can be much more agile than national government. And the point at which we saw this was beginning to fail was the point at which to give schools freedom and funding to make a local response, so that families wouldn't be put at a disadvantage. And I think if there's I absolutely recognise that the department, to be fair, is working incredibly hard in circumstances that are new to it as well. The officials that we deal with every day are clearly working incredibly hard. But I think it's introducing that level of agency for schools, that when things begin to go wrong, trust that they're not going to load up the exchequer with any more demand on free school meals. We know how much that is and how much should be there. So give them the freedom and the agility to find local solutions.
Yeah, I think it's a little unfortunate that the department did seem completely wedded to the Eden Red scheme, despite the fact that in answer to a question to myself, they've admitted that there was no exclusivity clause with Eden Red in terms of providing the system.
So I don't know about the commercial contract and the commercial complexities that exist around the Eden Red scheme. But I think it's that when there's no extra cost, so there's no debate about an extra burden on the exchequer, if it's going wrong, give schools the ability to find local solutions, because they're excellent at doing that.
Thank you very much.
Thank you. Just finally, before we wrap up, if you could answer briefly, both of you. I know we've touched on this quite a bit, but just do you believe there should be a catch-up premium to help those, I know perhaps you were talking about not using the word vulnerable, but those vulnerable pupils who've been left behind as we enter the aftermath of the coronavirus crisis?
So I think schools were under funding pressures before this crisis anyway, and the money that had been promised throughout the election campaign was only just beginning to be ready to arrive into schools. And we're going to be under even more pressure when we come back, particularly schools having to find the ability to deliver counselling services and extra support services, let alone their academic services. And therefore extra funding in the form of a premium will be essential. There needs to be quite a lot of conversation about what that covers and how it's delivered, but yes, it would be absolutely essential.
Emily?
Yes, I completely agree. There should be a catch-up premium, but again, I think it needs to be accessible to schools easily, and for schools to make the decision as to where it needs to be allocated, because there cannot just be a one response for every single school across the country in terms of a catch-up premium, because a catch-up, for example, in Tower Hamlets may be completely different to the catch-up premium that is required in Suffolk or Norfolk. So I think it needs to look into context for the requirements of the schools, and the schools to make the decision where it is going to be required.
Can I thank you both for some sustained questioning, and really appreciated both of you. I wish you well, your organisations well, your members well, and thank you, both of you, to all your members. Wish all your members every good health and safety as this goes on. Could all the other members stay online, please? And Emily and Paul will say goodbye to you just for a moment. Thank you.
Thank you for your time.
Thanks.
Thank you. Bye-bye.
Hello?
Education Committee, Tuesday, 12th of May.